Welcome to Raaonline. I am Dr. Sudakshina. Today we are going to talk about a case which is associated with nasopharynx, and it is brought up 7-year-old boy brought to a pediatrician's office suffering from blocked nose and oral breathing. On examination, patient presented a typical adenoid facies. Now there is a term called adenoid facies, in which the facial appearance of the patient will be typical. There will be nasal block will be present, so the patient will be definitely breathing from the mouth, so the oral breathing will be present. And on the detailed history also revealed that the patient had a recent ear infection. Now with adenoids enlarged, a patient has a risk of having repeated otitis media or ear infection. That I am going to explain in the following slides. Now, what is the structure involved is the question. What is the anatomy related to the structure involved? So, today we are going to discuss in detail about nasopharynx, the borders of nasopharynx, the boundaries, the roof, the floor, the lateral wall, the other features which are present in the nasopharynx. Where is the adenoids? Where is actually the nasopharyngeal tonsil present? And if it enlarges, what are the different problems which can a small boy, means normally it is very common in children. So the children can suffer from adenoids more than adults. They suffer more. So what are the other things which are involved with adenoids and what they can get actually in this kind of scenario when they present. Okay, so moving on. So we are going to talk about nasopharynx in detail today because our case is on nasopharynx and adenoids, and you are going to understand where exactly the adenoids are present. Now before coming directly to the nasopharyngeal tonsil or the adenoids, let's go through the boundaries of nasopharynx. Okay, so the most superior part, it is the most superior part of the pharynx. Now, if we see the pharynx is like a tube, okay, muscular tube. So, you have a most superior part of the pharynx, which is the nasopharynx. The middle part of the pharynx is the oropharynx, and the lowermost part of the pharynx is the laryngopharynx, which will be continuing as the esophagus. Okay, so the pharynx which is behind the nasal cavity, if this is the nasal cavity, the pharynx, the part of the pharynx which is just behind the nasal cavity is called the nasopharynx. The pharynx which is behind the oral cavity is called the oropharynx. Okay, and the pharynx which is just in front, behind the larynx, the inlet of the larynx is called the, so if this is the larynx, the inlet, so this is called the laryngopharynx. So with this kind of an understanding, we are going to move ahead with the nasopharynx per se today, because today our topic is nasopharynx. So definitely it is the most superior part of the pharynx. Now nasopharynx is situated posterior to the nasal cavity. That's what I told you now. The part of the pharynx which is just behind the nasal cavity is the nasopharynx. It has to be superior to the soft palate. So this is soft palate. So it is superior to the soft palate, and it extends from the base of the skull to the upper surface of the soft palate. Okay, so definitely it is extending to the upper surface of the soft palate at the level of C1 vertebra. So it is going up to the C1 vertebra, and if you see that we cut off at the C1 vertebra for the nasopharynx. Now concentrate on this diagram. You can see over here, this is the nasal cavity. Here is the oral cavity which is separated from each other by a hard palate over here. This is the hard palate, and behind this you are getting this orange color, that is the soft palate. Okay, so this part is the soft palate. Now what is there on the roof of the nasal cavity? So on the roof of the nasal cavity you can see over here that this is the ethmoid bone over here, and here is the sphenoid which is coming, and this becomes the basisphenoid as you go more posteriorly. So as we enter into the nasopharynx, so behind the nasal cavity, okay, so you have this upper limit of the nasopharynx which are actually the posterior nares, okay, or the choana. So this is the upper end of the nasal cavity, and as we see, this forms a sloping roof. So the nasopharynx has a sloping roof, and which is mainly formed by the body of the sphenoid or the basisphenoid along with the occiput or the basiocciput together. So this is the sloping roof of the nasopharynx. And where is the lower limit of the nasopharynx? So if we follow the soft palate, the lower edge of the soft palate exactly ends over here. And if we draw a horizontal line from the lower edge of the soft palate posteriorly, so we are going posteriorly, this will cut at the more or less at the lower border of the C1 vertebra. So arch of the atlas is the C1 vertebra. So this is C1 vertebra. So this is going to cut at the lower border of the C1 vertebra. Okay. So this becomes the lower margin of the nasopharynx. So you can see the upper margin of the nasopharynx or the upper extremity of the nasopharynx, the up to where it will start, where it will actually start, and where it will end is over here. So this entire area, what it is mainly called the nasopharynx. Now what is over here is, you can see this bone, definitely the roof is being formed by the basisphenoid and the basiocciput. But if you go deeper, like if we move little more deeper, you will get the medial pterygoid plate exactly over here. Okay, so the medial pterygoid plate will be over here. So there will be a bony bone also, which will be actually forming the wall of the nasopharynx. Now this part of the pharynx is immovable, and it is not going to, it is more or less fixed. It is more or less fixed. It is not going to move. It is immovable, and more or less it's like a box. It is fixed. Okay. So now coming to the other slides. So definitely behind the nasal cavity, the nasopharynx is lying. The roof is formed by the basisphenoid and the basiocciput. Posteriorly, you have the C1 vertebra, prevertebral muscles and the fascia. The floor is being formed by the soft palate anteriorly and deficient posteriorly, and you get the nasopharyngeal isthmus or the pharyngeal isthmus. Anterior wall, it will communicate to the nasopharynx through the posterior choana or the nares, and the posterior wall you will have the C1 vertebra. So let's